This is Congresswoman Virginia Foxx with a congressional update. The thing that's in the news most these days is the issue related to health care and health insurance. Congress has been dealing with this issue almost all year. There is currently a major bill in the Senate and a major bill in the House that are being discussed. I have with me today Congressman Dr. John Fleming from the 4th District of Louisiana, about to move your district there for you, whom I've asked to come in today and talk a little bit about this issue from your perspective as a physician. First of all, tell me a little bit about your background in medicine.
Yes, Ms. Fox, I am a family physician, board certified, residency trained, been practicing over 30 years. I practiced 6 years in the
Navy. You certainly don't look old enough to have practiced 30
years. Well, I appreciate that. I'm a
years.
grandfather times 2.
No.
Yes, one born only last week. And I also was in private practice since 1982, still have a private practice from time to time. And so I've really, also with my business background, have seen the economics, how they interface with medicine.
Great. Well, I know the people of your district appreciate the service that you've given them as a physician. Family practitioners are becoming more and more rare, and so
yes,
we're grateful for you.
Sure.
Tell me some of the things that you think we should be doing in terms of reforming health care. Republicans have been, it's been said about Republicans that we don't want health care reform.
Right.
And everybody from the president to those in charge of the Congress are saying that about us.
Yes.
But that isn't true, is it? No. We have plans, don't we?
Yes, absolutely. First of all, you know, Republicans began a few years ago with the health savings accounts, which have had a tremendous impact. Even in my own businesses, we saw premiums flattening out. So Republicans have been working on that on a slow, steady, incremental basis. Part D Medicare is another one that's come 40% under budget, the only government health care program that's ever been under budget, and that's because of private competition. Today, we have a lot of low-hanging fruit. There's a lot we can do to stop rejections as a result of prior existing illnesses, rejection because of current disease, the need for portability, tax deductibility. Of course, liability reform would go a long way towards saving money. So there is a lot we could do that would not in any way increase the cost of the budget, and yet somehow the Democrats would have us totally dismantle what is an excellent and in fact the best healthcare system in the world and remake it in the light of Cuba, Canada, and the UK.
Well, I'm glad that you brought those issues up. Accessibility we want. Yes. We can have people be able to buy health insurance themselves and not have to depend on their employer and take a tax deduction.
Right.
We believe in affordability, and we believe that if people are able to buy insurance across state lines, then it'll bring down the cost.
Right.
Well, increasing the pools that people are in?
Absolutely. Allow small businesses to pool their employees together so they can negotiate the big discounts that the big companies get.
And that's something that has been being worked on since I came to Congress 5 years ago.
Absolutely. There's a lot of insurance laws that can be and should be reformed that, again, do not cost any money whatsoever. And remember that quality always goes up and cost goes down when you have good, healthy, robust competition. To have the government to come in to have an artificial market of competition is only going to drive the cost and the prices up. We see that happening already in the CBO scoring.
And none of those things that you've mentioned are in either of the Democrat plans. Is that correct? Essentially
none. I will say that the Baucus bill does have the purchase of insurance across state lines.
Okay.
That much is there. But one thing we can say for sure, whether it's the Baucus bill in the Senate, whether it's H.R. 3200 in the House, is that we're all going to be paying more money to keep the same thing we have, whether it's taxes or through higher premiums of our insurance.
Right. And another thing about the Baucus bill is there really was no bill for people to look at until they voted on it in the Senate. Isn't that correct?
That's absolutely correct. And one thing that is common among all bills is they all get $500 billion from Medicare. And they say it's through efficiencies, but we've been over 40 years. Why haven't these efficiencies come forward? The President and the Democrats have yet to tell us what they are. And so I think that anybody who believes that gutting $500 billion out of Medicare is not going to affect services, I think they're really not thinking right.
Right. Now, I understand that one of the things they want to cut is one of the best things in Medicare, and I know I have a lot of my constituents participating, and that's Medicare Advantage.
Yes.
That's one of the things that's not good in both of the bills. Is that the way
Absolutely.
you see it?
Medicare Advantage, of course, is the private counterpart to Medicare using Medicare dollars. It provides preventive health services, hearing aids, visual things, and that's going to be kaput. And so when the President says you get to keep what you have, that certainly doesn't apply to the 25% of Medicare recipients who are on Medicare Advantage.
Right. Well, we have a little bit more time. Tell me some of the other things that are in the plans, either in the House or in the Senate, that are not going to be good for the American people.
Well, I think the core problem of all of this is the 52 or so new bureaucracies that are created that are going to go right between the patient and the doctor. You know, Virginia, that is a sacred relationship, one that we value, and it's really quite unique that we have in America, that even today with the programs that we have, that for the most part a doctor and a patient can make the proper decisions among themselves. But with this new bill, we're going to see situations that are going to rise where people are denied care. Even though they have coverage, they'll have denial of care because if it's delayed, let's say a year to get an MRI scan, care denied is certainly going to be created by care delayed.
Right.
So I think the doctor-patient relationship is what's going to really suffer if any of these current Democratic bills pass.
And don't we know from really good statistics, long-term statistics, that survivability for cancer, for example,
right,
in the United States compared to Britain and Canada,
yes,
it's significantly different.
Absolutely.
Isn't it?
The two most important cancers, prostate and breast, there's a significant difference in survival rates in America versus Canada and the UK, and the difference is the money we put into screening and the money we put into the best drugs, which these countries say they can't afford because they're already in the rationing, which we're going to have in the future if we pass these bills.
Right. Now you have a bill. Do you want to talk a little bit
Yes.
about the bill? Let me make one other comment.
Sure.
We have about 40 Republican bills.
Yes.
Some are comprehensive, some look at one issue or another. But I know you have a bill and you've been on TV talking about it. You've gotten a fair amount of attention to it.
Right.
Talk a little bit about your
Well,
bill.
it's a simple resolution. It's Resolution 615 that simply says that if a member of Congress votes for a government takeover of health care or a government run or public, if you will, option, that they would be willing to sign up for it. And we've had over 90 Republican members sign that bill. In support of it. We have over 1.5 million Americans who've signed in support of it, and I've reached out to every single Democrat in Congress and not one has been willing to support that. So I think that's the litmus test. If it's good enough for our people, it should be good enough for us in Congress.
Right. I suspect you'd share my philosophy. I will never vote for anything that sets Congress apart
Absolutely.
from the rest of the Americans. Nobody should ever do that. We are called representatives in the House,
Yes.
and that's what we should be, is representatives of the people. And to exclude ourselves from anything that the people are being covered is a mistake.
Absolutely. The Founding Fathers, that's what they had in mind when they created this institution, and that's what we should stay with.
Right. Well, we have a little bit of time left. Is there anything else that you want to say about this tremendous debate we're having? When I respond to my constituents, and by the way, I'm on your bill, so I should say I'm on your bill.
Yes.
But I say to people, this is probably the most important debate that the Congress has had in 50 years. And what I think many people don't understand is that it is going to have a tremendous impact on not only our lives, those of us
Yes.
living now, but on our children, our grandchildren, and for our posterity for years to come,
Absolutely.
if one of these bills passes.
Absolutely. First of all, healthcare is 17% of our total economy. If we socialize that, we're way down the road towards having a socialized economy, something we've never had in this country. Also, there's nothing more intimate and personal than healthcare itself. And now we're actually putting government into our personal lives in a way we've never seen. So I quite agree with you. I think this would be a turn in the wrong direction, and it would be something that has never been seen before, and hopefully never again. So it's important at this point that we keep the tone up, that we continue to reach out to our senators and congressmen and let them know that you are against this bill. We know that polls tell us the majority of Americans are against government takeover of health care.
A little statistic that I remember is that right now 85% of Americans are covered by some sort of private health care.
Yes.
And 85% of those people like what they have. Is that,
That's absolutely correct. And of those who are supposedly the 46 million or so who are supposedly not covered with health care, most of those are either illegal immigrants, 10 to 13 million of them, 5 to 10 million are people who have coverage but just don't sign up for it, 10 to 15 million young adult Americans who qualify for it but simply don't want to pay the money. So that gets us to a core of 10 million Americans who want coverage but can't get it because of pre-existing illnesses. Why destroy an excellent system when we can really focus like a scalpel on that group of 10 million Americans and help them out?
But the Democrats have really been unwilling to do that. Is that not
Absolutely.
true?
They shut us out of all meetings, discussions, even the president. We've not been able to get an audience with him at all.
Right. And you and our colleagues have offered amendments in the committees, right? You've
Yes.
offered I'm not sure if you offered your specific bill as an amendment, but I know that it has been offered as an amendment.
In all three committees, absolutely.
In all three committees in the House.
Also, we've tried to put a stop to taxpayer-funded abortions. Those amendments have been defeated. And we've tried to stop government funding of health care for illegal immigrants, and that has been defeated, all
Right.
according to party lines.
One other thing that has really struck me, which I've seen nothing much in the news about, is, as you were talking about, the figure that was used often and many over and over and over again by the president and others, is that there were 47 million Americans who didn't have health care.
Yes.
Well, we've debunked that. We know that's
Absolutely.
not accurate.
Right.
But in this latest bill, the Baucus bill, what the press says that 29 million Americans aren't going to be covered. So we went from 47 million Americans to the president saying at our
Yes.
joint session 30 million
Yes.
who didn't have insurance.
Right.
But even those 30 million, so we're only going to cover 1 million of the 30 million that they say need to be covered. That has just been a spectacular number to me.
And it's going to cost $1 trillion to cover those.
Right.
When in fact there are a lot less expensive ways to get better coverage. And really, I think what we're going to end up with at the end of the day, if this passes, is not only will we have government intrusion like we've never seen, but all of us, and that includes middle class and lower income levels, will be paying more for our premiums for private insurance or more in taxes, and we'll be getting less in the end.
Well, we're doing everything we can to stop it ourselves, and we hope the American people will continue to let their members and their senators know how they feel about it.
And I thank you for your valiant efforts.
Thank you.
Yes.
This is Congresswoman Virginia Foxx with a congressional update, and my guest today has been Congressman Dr. John Fleming from Louisiana. Thank you, John.
Thank you, Virginia.